Hello, everyone. As many of you may know, today is National Cancer Survivors Day in the U.S. By some estimates, there are as many as 17 million people walking around the U.S., people like us, like the three of us sitting here. My name is Steve Abbott. I was diagnosed almost 9 years ago, with advanced prostate cancer. And I'm happy to say that I am doing well and feeling well. I'm under continual treatment, but it's all good. It's going well. So here at Cincinnati Cancer Advisors, we see about 30 patients, maybe depending on the month, anywhere between 30 and 40 patients a month, 30 and 40, I mean. And they're all newly diagnosed cancer patients. There's occasional reoccurrence. But one piece of advice that I try to give to newly diagnosed cancer patients is just try not to focus on the worst. And, we all know what we heard growing up and the C word and what that all means. But I think everybody sitting here with me today would agree that the outcomes can be quite a bit better than that these days. So,
that's good to be terrifying.
Yeah. And so I'm living proof that cancer can be managed as a chronic disease. So I'm getting ready for a new round of treatments that will hopefully knock mine back for a couple more years, and then that gives research a couple more years to come up with something new. So we've come a long, long way in the last 30 to 40 years. There's a lot in the pipeline, a lot of newly developed and newly developing life-saving cancer treatments. And I know I speak for the full team when I say that we can't wait until nobody dies from cancer anymore.
Exactly.
So,
and you got this.
Yeah, okay, that's true. Thank you. I appreciate that. So, Dianna.
Hi, I am Dianna Abbott. I was diagnosed in January of 2015, 16 months after Steve's diagnosis. And I want to talk to you today about the treatment side effects. I went through lumpectomy, radiation, and chemotherapy. Chemotherapy was actually my second treatment.
I call that hitting for the cycle.
Yeah, really, knock it out. I was getting Neulasta shots in my stomach every time that I had the adriamycin Cytoxan to rally the white blood cells. Those would knock me back a little bit. The treatment is taxing, but not horrible. Most days I felt pretty good. I was able to work most of the days, not on treatment days because you're there most of the day for treatment, but in general, my experience was good. I mean, I was healthy going into it. I had been exercising regularly. I felt good, and that really helped with my treatment. I do have one piece of advice, though. Stay on top of your vaccination. Stay on top of your health care.
Yeah.
I discovered my tumor myself, and my mammogram backed it up. And I had been looking and testing for years to make sure that none of my lumps were different. Mm-hmm. And then also the fact that I unfortunately had not gotten a shingles. I wasn't old enough to get a shingles vaccine at the time. During treatment, chemotherapy really brings your white blood cell count down, and I unfortunately got shingles.
Yes.
Which Steve has had to experience on the other end.
I think it was the one time I saw you cry during treatment.
Geez.
It pretty much was the only time I cried. It was very, very painful.
So anyway, I think, and another thing that living with Dianna at the time, she did a great job of keeping your sense of humor, and that's critical.
Mm-hmm. And was that, I think I saw something about smallpox in your history.
Well, if you have had chickenpox,
yeah.
you will have the shingles virus inside of you.
Yeah, it remains dormant.
It may not rear its ugly head, but it is there.
Yeah.
And if you have stress, it's possible.
Movie reference.
Yeah, okay, he has a movie
Jurassic
reference.
Park, when the velociraptors are testing the fences.
Yes.
So the chickenpox vaccine is
constantly
it's always testing the fences. It's trying to break through your immune system.
So that's just one other thing, right, that you have to be concerned
and one
with
other
then.
thing I set him up for.
Oh.
Yeah.
Well, thank you, Dianna. As you all know, most of you, I'm Sherry Hughes. I was diagnosed in 2019 with invasive ductal carcinoma, HER2 positive breast cancer. And like Diana, I've gone through the full gamut of neoadjuvant therapies, everything from the chemotherapy to breast surgery, a lumpectomy as well. That's largely because I had a complete pathological response to the chemotherapy. I had radiation, about 5.5 weeks of that. Also immunotherapy, and I just recently, in the last month or so, wrapped up adjuvant therapy, which is another kind of therapy, immune therapy, to kind of help you post all of that other treatment. Now, I know that Steve and Diana both agree with me that cancer, when you're diagnosed with cancer and you're going through it, really kind of gives you a greater purpose in life, and that's why the three of us are here. We've all changed careers because of cancer, and I'm very fortunate to spend a good part of my time now working towards advocacy and to helping improve cancer outcomes for those that are going through it or may be going through cancer in the future. We hope not, but we understand that, there are more than 600 what is it? More than 1 million people each year. 1.9 that are diagnosed with cancer. Definitely. So one of the work that I've been doing recently has been around advocacy at the state level. And I'm so excited to let you all know that Ohio House Bill 371 passed in the Ohio legislature, and it's going to soon be on its way to Governor Mike DeWine's desk to be signed into law. And that's huge because it's going to help a lot of people survive. I was so proud to be a part of that lobbying up in Columbus. And again, that bill is going to be saving lives. And that means people will be able to get more advanced screening. The insurance companies will have to pay for that advanced screening, especially if you're a woman with dense breast tissue or you have a family history. And I was both. I lost my mom to breast cancer when I was a young woman and didn't know much about all of these different factors. And we had no risk factor in my family at the time.
Well, I think that's why they didn't find mine in the April mammogram that I had, because
dense breast
tissue, and it wasn't covered by insurance to have anything else.
And now this new law, when it is signed by the governor, is going to change all of that, especially for women in Ohio. And of course, I'd say men too, because men do get diagnosed with cancer as well. For me, I discovered my breast cancer, I say divine intervention, because there was nothing wrong with me. I was healthy, and no lumps, no bumps, no anything, but it was the breast MRI that detected my breast cancer. So I'm so excited about the new bill and also the law. This is just one example of what Steve and Diana and I are doing, talking to you all about how we could use our own resources and use our own experiences to help here at CCA to improve the outcomes for others. So we're so excited about the work that we're doing here at Cincinnati Cancer Advisors, and we absolutely salute all of you cancer survivors out there, not only today, but each and every day.
Yep. That's awesome. Okay. Well, thank you, Sherry. Thank you, Diana. And we will, hopefully we won't have to do too many more Cancer Survivors Days, but I think for the foreseeable future, we'll be back every year to talk about it. So
we
thanks,
certainly
everyone.
hope so.
Yep. Thank you.
Thanks, everyone.
Thank you.